Liposuction, also known as suction-assisted lipectomy, is a surgical procedure that slims and reshapes specific areas of the body by removing excess fatty deposits. It improves body contour and proportion, and in many cases can enhance someone's self-image. As with any surgical procedure, there are going to be risks associated with it, and this is true with liposuction as well. Most of the risks, fortunately, are rather minor, and these can include small scars, irregular pigmentation, collections of fluid underneath the skin, and some change in skin sensation. Perhaps one of the more significant risks would be some type of asymmetry or contour irregularity. I look at liposuction as very much a complementary procedure to lifestyle. It's not an either-or proposition. If someone has an area of fatty accumulation that's bothersome to them, then liposuction can very effectively improve the contour. However, one cannot expect a significant change in weight by liposuction alone. So the procedure is complementary to a healthy lifestyle, and I would always encourage an individual to exercise, eat well, and to get to as close to their ideal body weight prior to a surgical procedure. One of the fascinating aspects of liposuction is that the recovery is rather prompt. Liposuction patients will generally be ambulating the day of their procedure. They will need to use some externally applied compression to help the skin contract to its optimum shape. But there's very little downtime. Pain is quite moderate and often does not even require any type of narcotic use. The patients can usually be back to work in 3 to 4 days. Ideally, the surgeon has evaluated the patient closely and made a determination that the patient's skin tone is acceptable to be able to contract after the fat is removed via liposuction technique. This is critical in determining whether or not the result after liposuction will be good. The ideal patient will have reasonably good skin tone and should not expect that there would be loose or hanging skin after removal of the fat. If, in the estimation of the surgeon, the skin tone is too loose, then other alternatives may be more effective than liposuction alone. The percentage of patients who come for consultation who are truly good candidates for liposuction is approximately 60 to 70%. Unfortunately, the remainder, 30 to 40%, have issues such as loose skin tone, stretch marks, where in my assessment the skin will not redrape nicely, and they'll need other alternatives such as skin tightening procedures, excisional procedures such as abdominoplasty or thigh lifts. If a patient has good skin tone, has localized areas of fatty accumulation, they will be excellent candidates for contour improvement with liposuction alone. It's only those patients who in the preoperative assessment have significant degrees of skin laxity that I will make a determination that the aesthetic improvement would be improved with an adjunctive procedure.